Have you ever wondered what could happen if you suddenly stop breastfeeding your baby? Maybe you are tired. Maybe you are going back to work. Maybe your child is getting older and you feel it is simply time to stop. Or perhaps someone told you, just stop giving the breast. Your child will eventually get used to it. But here is something every breastfeeding mother should know. Suddenly stopping breastfeeding may not be the easiest or healthiest way to wean. And there are reasons why. When you breastfeed regularly, your body has adjusted to producing milk based on how often your baby feeds. So when breastfeeding stops abruptly, your body may still continue producing milk for a while. That can leave your breast feeling extremely full, hard, painful, or uncomfortable. Some mothers may experience significant breast engorgement, leaking, or blocked milk ducts. And in some cases, inflammation of the breast can develop into mastitis, which may cause breast pain, redness, swelling, and sometimes fever. But it's not only about the mother. Think about the child too. For many babies and toddlers, breastfeeding is not just about food. It can also be comfort. It can be reassurance. It can be part of their bedtime routine. It can be what they look for when they are tired, upset, sick, or simply need closeness with their mother. So imagine suddenly taking that away without giving the child time to adjust. Some children may become more clingy, unsettled, irritable, or find it difficult to sleep. And this is one reason gradual weaning can be easier for both mother and child. Instead of stopping everything overnight, you can gradually reduce breastfeeding sessions overnight. You might start by removing one feeding that your child does not rely on as heavily. Then allow your body and your child to adjust before reducing another feeding. You can replace some breastfeeding moments with cuddles, affections, meals, or snacks when age appropriate, water, or another suitable feeding option. And there is something very important here. The right approach to weaning depends on the age of the child. If your baby is under 12 months, simply stopping breastfeeding does not mean the baby can just switch to ordinary food or drinks. Breast milk or an appropriate infant formula remains important during that stage. So you should speak with a healthcare professional about how to make that transition safely. For older babies and toddlers, the process can look very different. There is also no single perfect age when every mother must stop breastfeeding. Every mother and child are different. Your circumstances are different. Your child's needs are different. And sometimes weaning happens because of circumstances that are completely outside your control. So please don't feel guilty if you are ready to stop. So the most important thing is how you approach the transition. If you are considering weaning, don't feel pressure to go from breastfeeding several times a day to absolutely nothing overnight, unless there is a medical reason that requires it. Give yourself and your child some time to adjust. And please, remember, if you develop severe breast pain, redness, swelling, fever, chill, or you feel unwell, seek medical advice. I wanted to share this because I have come across so many different opinions about stopping breastfeeding, and some of them can be misleading. There is actually much more to know about weaning than simply just stop. So, in my full YouTube video, I will explain what can happen when breastfeeding is stopped suddenly, why gradual weaning may be easier, and some practical things you can do to make the process more comfortable for you and your child. So if you are a mother who is thinking about stopping breastfeeding, don't make that decision based on pressure or hearsay. Learn what your body and your child may go through first. Because weaning is not just about stopping breastfeeding. It is a transition, and it deserves to be handled with care. Watch the full video on Moms and Caring to learn more.